Mitochondrial disease is really hot topic. First of all, it's fascinating, right? And it really entails every aspect of medicine. This is why I'm inspired by our patients and families, and why I like taking care of patients with mitochondrial disease.
Diagnosing primary mitochondrial disorders is pretty complex. So hearing different approaches from different specialties and their perspectives is pretty important. This is the best you can learn from mitochondrial medicine.
Yeah, the challenge of mitochondrial disease diagnosis is the multi-symptomatic nature of it. Oftentimes overlaps with many other potential diagnoses. For primary care physicians that may not see a mitochondrial disease patient very often, if at all, this is really an opportunity to learn about the types of symptoms to help lead to a clinical diagnosis.
Just in the last 5 or 10 years, we've really managed to get the tools together to come up with accurate diagnoses for a significant fraction of patients.
Similar to my experience when I was working in the hospital, most clinicians are not very familiar with mitochondrial disease. However, these patients exist in every community across the country and in every hospital system across the country. And so I think one of the most powerful things was explaining how community hospitals and tertiary care centers can connect with patients and their families to provide that optimal care.
We're at the start of a new frontier in mitochondrial disease. As a geneticist, our diagnostic ability has improved. We still need to do more. There's still more patients that we're not diagnosing.
The advice that I have is to train with a doctor who specializes in mitochondrial disease. It's really hard to learn this on your own.
Yeah, it's incredibly important that we work diligently to train the next generation of clinicians and researchers in mitochondrial disease. These are the folks that are going to propel the research forward, take care of our patients in the future, and hopefully be the ones that lead us to the treatments and cures that we all want for mitochondrial disease patients.